At any given time, there are about 11 million women in the United States taking a combined oral contraceptive pill. The first case report of a clot in a woman taking the pill was published in 1961, and since then there have been many large epidemiologic studies that confirm this risk. But an open question remains whether different formulations of the pill affect clot risk differently. And this is really hard to answer because women will often switch from one formulation to another and go on and off the pill during different periods of their lives. What you need is a database that has really robust prescription data and hard clinical outcomes, and this is just what we get in an article appearing in the British Medical Journal. Researchers used two large UK general practice databases to perform a case control study. Cases were women who had venous thromboembolism, and controls were women who did not. Risk factors between the two groups, including the use of various forms of oral contraceptives, were compared. Now, the devil's in the details, and the best way to mess up a case control study is to choose the wrong controls. And there were some quirks in the BMJ study. There were different exclusion criteria applied to the two groups, for instance. The cases were excluded if they had received an oral anticoagulant within 42 days of entry into the cohort, whereas the controls were excluded if they had ever received an oral anticoagulant. That would tend to make the cases a higher risk group overall and could bias the results. Now, what were the results? Well, women who were taking an older second-generation oral contraceptive pill had about a 2.5-fold increased risk of clot. Women taking newer third and fourth generation pills had a 4 to 5-fold increased risk of clot. Now, are these results real? It's a bit hard to say. It's conceivable that docs who prescribe these newer, fancier oral contraceptives are more vigilant when it comes to looking for clot and inflate their diagnosis rates. But regardless, the absolute risk remains very small. We're talking 7 extra clots per 10,000 women taking the older second-generation pills and 14 extra clots per 10,000 women taking the newer third and fourth generation pills. At this point, it seems reasonable that if a woman is particularly concerned about the risk of clot, choosing a second-generation pill is a reasonable option. Of course, if women have significant clot risk factors like smoking or age above 35, choosing a different form of contraception altogether may be an easier thing to swallow. For MedPage Today, I'm Perry Wilson.